Care, Public Health and Housing Needs Committee. Thank you to everyone who's made the effort to come this evening. We know that the weather outside is not really what you want to be travelling through this evening, so I do appreciate all your time for being here. Just so we can, before we go into apologies or in the agenda, just to go through the fire drill. You're more likely to get flooded at the moment because one of the windows is really leaking, but we'll go through the fire drill anyway. In case of an emergency, there are no planned fire drills this meeting. If you hear the fire alarm sound, please treat it as a real emergency and evacuate the building via the nearest safe escape route. The nearest escape route is via the stairs to your left as you leave the council chamber or public gallery. Exit via the door at the back of the building and walk across the inner car park to the evacuation point, which is the pavement opposite the police station. The lifts can't be used in the event of an emergency. Please do not re-enter the building until you're advised it is safe to do so by a member of staff. Just when we start, item 1 on the agenda is apologies and substitutions. I'd like to thank Councillor Chris Quirk, who is substituting for Councillor Martin Oliver. Councillor Jarman is dealing with a huge amount of water in the West White at the moment, and has been involved with trying to help with the issue, but clearly can't make it here this evening, but has kindly joined us online. Councillor Debbie Andre has joined us online as well. She has been very poorly, but is attending online because this is something very close to her heart, and was the cabinet member when we had the previous domestic violence strategy. So it was really important that we allowed Debbie to come online this evening. Neither of those councillors will be able to vote, but we are quorate, and Councillor Redrup is on her way. She is fighting through traffic at the moment, so she will be here. If we could just go to the minutes of the previous meeting, are you all happy that they are a true record of the previous meeting? Anyone have any issues with them? No? Okay, then I will sign those. Does anybody have any declarations of interest? No, we're all okay. And I do believe that we haven't had any public written questions, but we do have a public question from the gallery, which I will allow. So could you go to the microphone and introduce yourself and ask your question, please? I believe it's for the ICB, isn't it?
Can you hear me okay? Okay. Hello, I'm Becky McGregor, CEO at Mountbatten, and I was going to actually ask a question at the point that James Roach from the ICB, unless you want me to ask at this point. I don't mind either way.
Do you know, I'm the most lenient chair going, so I'm quite happy that you take a seat, and then when we start on that part of the agenda, I'm quite happy if you come in and ask that question of James. I completely agree, but I have to do it by the agenda at the beginning and say that you have a question, so it's fine.
Thank you very much.
One of these days, Mel's going to throw something at me by going, "You're not allowed to do this," but you know, we're going my way at the moment. Members' questions time. Do any councillors have a question? No? Are we happy to go into the main part of the agenda? Yep, we're happy. This evening, could I introduce some of the people who are online before we go into the House Scrutiny section? In person, we have Andy McDonald. He's the Isle of Wight District Commander from Hampshire Police. We have Tracy Jackson, the Paragon Manager, the Isle of Wight Manager. Online, we have Kelly Diamond. I'm looking at these screens as well to see that we have a Kelly Diamond. She's meant to be online. Who is Partnership Manager, Isle of Wight Safeguarding Children. She might come on in a bit. We should have Jane Hardy. I can see Jane Hardy. She's the Assistant Director, Paragon. Good evening, Jane. We have Tracy Kent, who is Director of Operations, Hampton Trust. Yes, yeah. And we have Emma Taylor, who is the Team Leader for the Hampshire and Isle of Wight Victim Care Hub. So before we go into the domestic violence part of the agenda, we had asked for James Roach from the ICB to come and attend this evening and give us a bit of an update on hospice and pharmacies. James, I did agree that you could come in online, and you know what? I'm really glad I agreed that now, because yeah, I think ferries are going to stop and things like that soon. So I think you're probably sat at the right side of the screen. And I apologise to anybody who's got to get back on a ferry tonight. I think that's you might struggle at the moment. So I apologise in advance, but thank you for coming. James, I think this is the appropriate point for the question to be asked from the hospice. Is that okay?
Yeah, and I've got an update on pharmacies as well, Chair, and apologies I can't be there. I'd rather be there in person, but circumstances and weather has battled against me on this occasion. So thanks for accommodating the Teams link.
That's no problem at all. We will now ask that question. Is that okay? Thank you. You need to press the red button.
Oh, sorry. Is that better? Okay, hello, I'm Becky McGregor, I'm CEO at Mountbatten, and we have very much been working very closely with James and the team, and have welcomed the really constructive conversations. So the discussions we've been having is that any cuts in ICB funding, of course, will unfortunately lead to cuts in essential services from Mountbatten, and that's against a financial context of making cost efficiency savings over the last number of years. Indeed, our staffing costs have increased by 1.1 million over the last 3 years. That is an amalgamation of NI costs and also the direct context of the NHS pay awards increases year on year. So that is a significant increase in cost for us over those years. And that, of course, is not covered by our ICB contract uplift costs over those 3 years. We are continuing to operate in a very challenging fundraising landscape. Our island community is incredible in terms of how it supports the hospice. And I know many of you round the table do indeed support the hospice. But for every £3 of our ICB funding, our community is funding £7 of the services provided at Mountbatten. And very much we've been talking with James around the decision making and the timing of the decision making in light of our budget setting for 26, 27, and that is becoming really critical. And I guess really I know James very much wants to commit to giving that time framework this side of Christmas, and we really welcome that, and that being formally in writing, which is incredibly important for our board of trustees in terms of some of our decision making going forwards. So it's really more a comment and I guess a real commitment to hear from James around that you know, kind of commitment in terms of what our opening value of contract looks like for next year in order for us to plan our services moving forward. Thank you.
Thank you. Hopefully you heard that, and it's
I did. Yeah. Can you hear me, Chair?
I will hand over to you, James. Thank you.
Yeah, I mean, first of all, I think I just want to thank Becky and Duncan and Chrissy and Ian, the chair at the hospice as well, because we recognise this is challenging for lots of different reasons. There's challenging because there are things out with our control. Some of that is national. It's also challenging, I think, because all organisations face a financial reality. But I think despite that, and Becky's right to signal that the conversations have been constructive. I think constructive is a good thing, but actually I recognise we now need to start to ramp that up in terms of what the commitments are from the 1st of April. I'm committing to writing back to Becky and the board after a meeting on Monday just to confirm what that means for April the 1st and what the transition looks like. When I was last in front of the committee, I think I reflected pace of change and pace on this and decision making, and perhaps focusing on pace at the expense of understanding holistically what the hospice service provides. I think one thing we have been able to achieve over the last couple of months is get a real understanding of the core service offer, the bed base, the transformational opportunities that exist within the hospice, the willingness of the hospice to work in partnership. But also, I think, as Becky has outlined, there are no doubt costs that the hospice are bearing that perhaps they shouldn't bear in the future. And one of the things I'm really keen on, as well as landing the appropriate contract value, is making sure that some of those costs are met in different ways, so they're not borne by the charitable pound, if you like. So the conversations have been challenging, they've been constructive. It's been helpful to understand some of the key lines of inquiry. We've got a meeting on Monday, and Becky and I met last Monday just to highlight what we think of those key lines of inquiry, what we think the red lines are. I have a view on what transition would look like. I also have a view on what opportunity is within this space as well. We absolutely recognise the valuable service that the hospice provides in its current form, but I'm keeping one eye on what the hospice can do in the future as well, in line with the neighbourhood health NHS and working in partnership with other providers. So I think it's fair to say, Chair, we are at a key point where we need to land an agreement on contract value. Alongside that, I think we need to have a more pragmatic view on the timescales, the pace, the transition, and what we're aiming for long term. So I think all of those issues are on the table. I think we now need to be clear as commissioners. So what I have committed to Becky is that we would write back next week with an understanding of the 1st of April. I'll say this now, and I'm committed to making sure that there's absolutely no surprises in that. The 1st of April is not that far away, so we need to make sure that we do that in a realistic, and we do that in a partnership way as well. The other thing then we're aiming to do, and I think Becky might want to touch on this, is then really get into detail in January to make sure that the core contract, in terms of its themes and headings, are addressing the key issues. So I think, Chair, in summary, conversations are ongoing. I'm under no illusions in terms of how challenging it is. But as I said last time, I'm absolutely committed to getting this in the right place, to ensuring that we've got all issues on the table and we resolve in a timely way.
Thank you. Before we move on to the update on pharmacies, do any of the councillors on the committee have a question? Are we happy to move on to pharmacies? Happy to move on? Thank you, James. Can we move on? And Becky, you happy we move on to pharmacies? Is that okay? You're happy? Yes. Okay. We'd like to know you're happy out there as well. James,
Yeah.
could you update on pharmacies, please?
Yeah, just a quick one, because I know the commander's in the room. Just to thank him for all the work we've done with the recent spat of break-ins on the island. As you know, we had more break-ins than we would consider normal, if you like, in terms of pharmacies on the island. That created great concern for contractors and the public. And with the support of Kate Harvey and her team and the commander and some of the other public services on the island, we were able to put in place a plan. That plan was about assurance. I think one of the things we were able to do after the advice of the commander and the safety team was identify what changes needed to be made to those pharmacies to make them more secure. So we've agreed a number of changes that need to be made to those pharmacies to prevent future break-ins, and we've agreed to fund that on a one-off basis with those pharmacies. I'm not sure if the commander might want to add to that, but it's a good example of where we've worked in partnership with Public Health of the Council and other public services on the island in terms of addressing what's been quite a shocking issue. But I think it's really important that we support our contractors, but also provide reassurance to the public as well that we're addressing those issues. The other thing I just want...
The commander is nodding his head. I'll let him just quickly come in before we move on to that.
Thank you, Chair. Thank you, James. I can't really add much more than James said there. A partnership response was stood up really quickly. Some really honest conversations were had. And actually, what I would say was that I have to put that back to James in terms of his commitment and support financially for the recommendations that were put in place. But it's about a community need. You know, the impact of pharmacies being shut for periods of time across the Isle of Wight is significant, but actually from a partnership perspective, we really put a quick time response into that need at that moment.
Thank you, James. Thank you. I'll
Okay.
bring you back in.
Yeah. I do want to touch on the J Hoots issue. So you'll remember that we updated on this in detail at the last meeting. Since then, we made the decision to remove J Hoots from the register, from the professional register. So we took affirmative action. They've appealed, and it's now in the hands of administrators. And I can't say any more than that at the moment. But it was publicly noted the action we've taken on the island in terms of contract enforcement. We obviously have concerns around the other J Hoots pharmacies, and we've been working through with the pharmacy team locally and NHS England in terms of contingencies. We're trying to manage that effectively within the regulation, but also the legal guidance. So we are looking and we are funding extended hours opening of other pharmacies that are local. We are supporting those pharmacies to do more should they wish to do so. We are extending that for a minimum of another 6 months, and we are supporting with comms and messaging around the JHOOT situation. There is some green shoots nationally in terms of what happens to that group in the future and whether administration puts a more formal commercial model in place, but we're not assuming that will happen, and we're absolutely making sure that residents' pharmacy supply is maintained, and we're working with our practices and our pharmacies to sort of take that forward. The only other point I would make, Chair, is just to note the really good work that our pharmacies have done on Pharmacy First. We're seeing increased number of referrals across all pharmacies on the island and PCN areas. We have seen a significant increase in the number of people that now use their pharmacy for oral contraception in the Isle of Wight. And also we've got a really good sort of service around blood pressure as well. So for me, there's something about dealing with the crisis we're facing currently with JHOOTs, but making sure we put a more sustainable service plan in place for the island. So with your agreement, I'd like to come back in 2 meetings' time with a bit of a firmer strategy for 2027. By then, we'll have an understanding of what it means in terms of the JHOOTs issue and what that means in terms of pharmacy provision for the island. But at this stage, I think it's worth commending the pharmacies we've got for all the additional work they've taken on and still being able to provide a range of clinical services in addition to their core business as well, which no doubt is very helpful during the winter period.
Thank you, James. I think it would be good if you could come back in the February meeting. That actually will be our last meeting of this council term, won't it now? So if you could come back in February and give an update, James, that would be really good. If you could manage that, we'd appreciate it. James, thank you very much for your time. Thank you ever so much for Becky and Duncan. It's Duncan up there, isn't it? Just coming in from the hospice. We appreciate it. It's very cold up there. You are most welcome to leave. You don't have to sit through the next part of the agenda. Although I do have to say, the scrutiny on domestic abuse services pathway, and then to bring in the strategy to be part of our actual meeting. Is something that has been really driven by our vice chair, and this has been really important to her, and also by the previous councillor cabinet member, Councillor Andre. So I think it was really important issue that actually we needed to make sure that the whole of this meeting was really dedicated the amount of time to such an important issue on the island. So I am going to hand over to Nicole. So Nicole, thank you, and I'm really glad that you joined us on the Isle of Wight as a consultant. Your services are greatly appreciated. I interviewed Nicola and she was stunning at her interview and has been doing a stunning job, so it's appreciated.
Thank you, Chair. That's really lovely. Thank you. And thank you, Chair and councillors and everyone else in the room for giving us your time and your attention this evening, because this is something that we're all really passionate about. We're here to present our Isle of Wight domestic abuse pathways to scrutiny. You'll see that we've got a large number of speakers lined up to talk to you tonight. The chair has already introduced all of them. I also want to say that I've got my colleague Laura here and Kirsty behind me as well as my domestic abuse team on the island. It's vital to have this many voices because tackling domestic abuse is a united effort. On the island, we have a team of services and experts working together to keep people safe, reduce harm and support recovery. Domestic abuse is one of the most significant public health and safeguarding challenges on the island, and its impact reaches far beyond immediate harm. It affects mental health, child development, housing stability, community well-being, and many other factors that are absolutely key to us in public health. Speaking to you today is particularly timely because this morning the government released its new violence against women and girls strategy, which centres around prevention and support, as does our work. While that strategy rightly focuses on women and girls, we know that domestic abuse can affect anyone, but the overlaps are really vital to address as well. Our work is inclusive
and it's trauma informed, and it's designed to ensure that everyone on the island can access the support that they need. Our approach reflects our 3 priorities in our strategy, which you'll hear more about later: protection and reduction from harm, prevention and reduction from harm, increased access to specialist support, and collaboration and working together across services, which is what we want to demonstrate to you tonight. Every disclosure is an opportunity to prevent escalation, and every intervention is an opportunity to save lives. Our pathways are complex because domestic abuse is complex, and it's vital to meet the needs of the individual at any stage. However, despite this complexity, our pathways are designed to be clear and consistent for both adults and children, ensuring that every victim survivor gets the support that they need. Tonight, you're going to hear from our key partners about how these pathways work in practice and the difference they make to islanders every day. I'm now going to hand over to Jane Hardy, who's going to talk about Paragon and how they fit into our pathways. Jane.
Good evening, everyone. Apologies that I'm not there in person. Unfortunately, I had a pre-scheduled engagement in West Sussex, so I've just made it home to North Hampshire. I basically aquaplaned all the way home, so I'm pleased to be here in one piece. So I'm going to talk about the Paragon Isle of Wight Domestic Abuse Service, which is delivered by the U Trust. Next slide, please, Nicola. So we have been delivering the Commissioned Domestic Abuse Service on the island since 2018, and we work with children and adults who are experiencing domestic abuse and provide a range of services to support each individual in a person-centred and trauma-informed way. We have our single point of contact for referrals and provide a range of options into the service, such as emails, website, web chat and telephone. We provide one-to-one support for high and medium risk victim survivors who are currently or have recently experienced abuse. We also provide our 6-bed refuge, which supports women and children fleeing domestic abuse, and will also accept those currently living on the island. We also provide target hardening, which supports clients to safely remain in their own home, so don't have the need to flee. Our health advocates is co-located at St Mary's Hospital and works in partnership with the safeguarding team within the hospital to support victims and survivors accessing any services in the hospital, and also support staff experiencing abuse. We work closely with schools. Our children and young people's team supports schools and colleges across the island. We provide advice to staff and support to children and young people who are experiencing domestic abuse in their own relationships and have also witnessed abuse within their own family homes. We also support schools to raise awareness of domestic abuse through healthy relationship work, in PSHE lessons and assemblies. We also provide our therapeutic recovery groups, which offer recovery support to clients who no longer require one-to-one support, or for individuals who have experienced historic domestic abuse, to support them to move on and understand their experiences. We also provide counselling, which is available to individuals who require ongoing support to deal and recover from the trauma they've experienced, which continues to impact their lives. We also provide training and awareness, which is normally delivered through our Dragonfly Champion programme, which is delivered throughout the island, and also through our NHS staff training, which is delivered by our health advocate. We also attend many events across the island to support the community to recognise and respond to domestic abuse. And from January next year, we'll also be delivering the Family Court IDVA service on the island, which is a new project, which is all part of the Family Court reforms. And this will see a Family Court IDVA working in conjunction with CAFCAS and the local authority and HMCTS. To improve risk identification and victims' experience of the family court process. So we're really proud to be part of that, and that will make a huge difference. We hold leading lights accreditation, so all of our services on the island are scrutinised by Safe Lives, and we meet their standards for all the delivery. Thanks, Nicola. Next slide, please. So we have specialist teams that provide a whole person family approach to support the victim and their family to live safely and recover from abuse. And the types of supports we provide is both practical and emotional support. We provide safety planning and risk management, housing and financial options. We support with the criminal justice processes as well as civil legal options. We provide domestic abuse education, and we provide advocacy and referrals to other agencies, as well as our recovery and counselling. Our service aims to contact victims within 24 hours following a referral, and we provide trauma-informed support, which is offered one-to-one in a variety of ways that is agreed with the client, both face-to-face, online and telephone. And the support we provide is based on the risks, needs and wishes of the individual. Thank you, Nicola. So I just wanted to give some stats here for you. So since October 2018 to December 2025, we've received a total of 8,969 referrals. 1,789 of those were received in the last 12 months. I think since 2020, our referral rates have doubled on the island. And you can see the stats there. So 81% of the referrals in the last 12 months were for female, and 19% were for males, 4 were for transgender individuals. From those referrals, we also have 318 referrals for those under 18 years of age, and that shows the work that we've done with schools and colleges across the island. And 216 referrals were for the over 55s age groups, which represents 12% of all our referrals. Our average engagement rate for referrals is 67%, and this rate compared to mainland services is extremely good. Across the mainland, we would generally see referral engagement rates of around 40% and below. And so we're really proud that we're able to obtain that high engagement rate. We also have a really good referral source ratio. So 50% of our referrals will come from police, which again is actually quite low compared to the mainland. We normally see in the mainland that around 75 to 80% of all referrals into domestic abuse services come from police. And this really evidences the work that we've done with other agencies on the island. So 34% of our referrals are coming from other agencies on the island, which is a really high ratio. And we also see 16% of self-referrals from victims directly. Thank you, Nicola. We do a lot of working in partnership across the island. We've built really strong working relationships with lots of the other agencies. We recognise that as a single agency, we cannot tackle domestic abuse on our own. So we prioritise working in partnerships with other agencies. So we have monthly drop-in sessions, which we hold at Inclusion, which also includes the mental health teams and sovereign housing. We have monthly sessions at the Salvation Army. We meet weekly with the Island Police and have fortnightly meetings with the Victim Care Hub. We also have regular meetings with the housing providers and work in partnership with them to support the clients that we hold in service to access appropriate housing. And we also have regular drop-in sessions at West White, Wootton, Gurnard community centres, and that has a focus on older people. And we also attend the really useful Thursdays at Ventnor. And across the island, we attend agency team meetings to promote the service and support other agencies to recognise domestic abuse and refer individuals to us. And as our normal kind of working business, we also attend Marek and Herder to be the voice of victims at those meetings and help to minimise any risk from their perpetrators. Thank you. So across the last year, I said we also provide training and awareness. So we have trained 154 Dragonfly domestic abuse champions over the last year on the island. And this is from a variety of charities and communities and agencies such as the DWP, local council staff, churches, men-only groups, mental health teams, solicitors, education and the judiciary. And we're really proud of the workshops which we deliver, and we get really excellent feedback from individuals on how the training really helps them to support people in their community. Across the NHS, our health advocate has trained 819 NHS staff in the last 12 months to support them to recognise, respond appropriately to domestic abuse. And this includes departments such as emergency department, maternity, AAU, ICU, GPs, occupational therapists, the mental health teams, ambulance call handlers, and majority of the wards. And we continue to offer this training across the trust to support those staff in those roles. Next slide, please. So just some client feedback from you. I'll let you read that yourself, but we regularly collect feedback when we are on exit from the service from our clients, and use these to support and develop our service further to meet the needs of our clients on the island. But we're really proud of the service that we deliver and have delivered since 2018, and look forward to kind of developing the service further, working in partnership in these kind of difficult times ahead for all agencies. Thank you.
Thank you, Jane. Thank you. I'm now going to move on to Victim Care Hub. We've got a representative online as well. We've got Emma.
Yeah, Brill. Thank you. Good evening, everyone. So my name is Emma. As we introduced at the start, I am one of the team leaders from the Victim Care Hub. So just a bit about what kind of work we do. The Victim Care Hub more nationally, so we're part of Victim Support, which is kind of I guess a name that people might be more familiar with, but locally we are commissioned as the Victim Care Hub. We've been commissioned through the Police and Crime Commissioner, and we were awarded our contract in 2024. So the goal and the vision being that it is that collaborative approach, and it is that initiative that brings together a range of support services that work in partnership. So that is kind of a common theme, I guess, across our service and the goals that we have. As much as we cover Hampshire, we absolutely within this contract have had a focus on the Isle of Wight and how we boost the support and the provision of support that we have previously provided. We now have kind of 2 specialist workers who are based residents on the island, one of which is a specialist domestic abuse worker, and they also deliver specialist children and young people's work as well. And then within that as well, our community engagement officer often comes over and does events on the island to ensure that that outreach is fully there. So as I mentioned, the Victim Care Hub is that collaborative approach. We link in and work alongside partner agencies and other commission services, both on the island and mainland. So you can see Paragon and Hampton Trust referenced on that slide there, who are obviously here today. And the goal being that we can link in more effectively, we can work alongside more effectively and share that learning and understanding. Within the context of domestic abuse, it is kind of one of the learnings that has come out from DHRs or DARDAs now around that kind of shared learning and collaborative approach. So it's something that we have definitely aimed to really deliver as part of this contract. We are based across the county and on the island, so on the island specifically out of the Newport Police Station, but we also have a presence in Jubilee stores as well. So again, the goal being not only just to support the officers within the work that they're delivering and kind of what that means for them when they're engaging with victims of domestic abuse, but also open up those opportunities to engage more broadly and engage with other partner services and agencies. And it's opened up avenues to do maybe some more community engagement, drop-ins, events and things like that, just to boost that presence and the awareness across the island as a whole. Thank you. So this slide kind of goes into, I guess, a bit more around the values of our service. They're kind of 4 core values that I guess I would bring to this really for today. The fact that it's free, I think, is a vital part of the services that we deliver. It needs to be accessible financially as much as anything else. We are independent from the police as much as we are based out of those. We're co-located. We do hold independent spaces, and we ensure that that is independent support is accessible to those that we reach out to. It's completely confidential, and the key bit I think for this is that it's absolutely tailored. We always complete needs assessments, we always complete reasonable adjustments. What is that preference? How do we make sure that it's trauma informed? How do we make sure we've captured that individual's voice and what they're looking for out of support? We offer face-to-face, we offer virtual support, if that's via video, in homes, in the community, in schools. We want to essentially make sure that any way that that individual on the island wants to access support, we can facilitate, and it ensures that consistent approach for those that we're supporting, yes, on the mainland, but it's the exact same for those based on the island as well. Thank you. The support that we deliver, we kind of have a core and fundamental structure to the work that we do, and we use this basis to then further tailor to individual needs. For a bit of context as well, so we are the commission provider for standard risk support across the island, and that includes historic abuse as well. So these kind of fundamental areas of our support allows us to kind of really explore around the needs and the impact that domestic abuse might have had. We absolutely want to ensure that that victim feels safer. Around that target hardening as well, we can provide full and comprehensive safety plans, connecting them in with other services, other agencies, building their support networks, providing with information that they might need about their rights, validating feelings, developing coping strategies. We want to kind of hold that very holistic view around what recovery might look like for someone and ensure that we're able to kind of really help them steer that in the direction that they're hoping to go. The support, as much as I've said, is both standard and historic. That's also if it's reported or unreported, and at any point in that criminal justice system process. So we have absolutely supported people where the incident might have occurred 30 years prior. It makes no difference to us if that individual wishes to seek support, wishes to seek that advice and guidance. Absolutely, that is something that we're willing to have that conversation about and put that support in place for them. Next slide, please. So obviously we're here today to discuss around the service we deliver for DA specifically. Similar to Paragon as well, we are Leading Lights accredited. So again, we have undergone that scrutiny to ensure that we are delivering a service of a particular quality. We are absolutely, we will identify risks. So should they be medium or high, we'll follow that referral pathway and we'll refer into kind of partner services, we'll refer into Paragon and make sure that they have that specialist service available to them as well, regardless of how they've come into us. And I've highlighted at the bottom of that slide as well, we do have that specialist children's and young people's team. We want to ensure that we are able to deliver that family approach. We want to be able to ensure that that individual can access support from not just themselves, but considering those children impacted as being kind of victims in their own right and what that means for the family as a whole, and the fact that both are available to them. If that child has been impacted by domestic abuse, we can support them regardless of whether that parent is in support with us or not. So again, we're able to take on the views and needs of that child and capture that child's voice, and equally as well going into schools, community settings and deliver that service. And similarly to adults, if it's reported, if it's not, we're obviously following the relevant safeguarding measures, but we want to make sure that we're keeping their needs at the centre of the work that we do. Thank you. Next slide. So I guess following on from the conversation around supporting obviously victims in their own right, the children and families affected, I want to make it really clear as well that part of our core service is supporting any victim or witness of crime. In the context of domestic abuse, I think it's really important to note that that could be friends, family, colleagues, community leaders or teachers. If someone has been impacted by domestic abuse, is really struggling and wanting to seek advice, or they're not sure what to do if they're supporting a friend, they can access our service and speak to us about that. We can deliver the ad hoc advice, it's not a problem, but if they also need that ongoing support, we absolutely can. And I think the goal of that being that it will add that further resilience to the community as a whole. Fab, thank you. Now, I could have put this a bit further up the presentation in fairness next to our kind of values, but it's worth mentioning around the Victims Code. Any victim or witness of crime, again, will absorb these kind of rights. Part of this work and kind of what we've done under this contract is oftentimes victims have struggled to receive updates maybe around their cases or what that engagement with police might look like. We have, as part of our service, victim care hub officers. Now they are kind of linking with the police. If, say, for example, someone's struggling for an update, we can do some police advocacy, we can help obtain that, link them in with that officer, and make sure that they have a more seamless way in to obtain the information that they need. People might struggle to sit on 101 for various reasons. You know, it might be a long call queue, or they might not have the ability to do so for their own risk. So it just allows us the more seamless way to connect them in and support them in that journey through the criminal justice system process. So I thought I'd link that in with the Victims Code because, you know, the right for updates and the rights to be understood, it's absolutely an integral part of what we do. We try and enhance that victim's experience as much as we can. Next slide, please. And just to kind of, I guess, move on, we have an app. Some people sigh at the idea of another app. Some people are quite pleased that there's a virtual option for support, but it is worth saying in the context of domestic abuse, it is that confidential space. It has guides, it has that digital ability to support virtually. We've got the access to the 24/7 live chat services through that app as well. And it provides that space if someone wants to kind of maybe have a bit more self-led recovery, they can access that through here. We acknowledge within that, if someone's in, say, for example, there's tech poverty, they might not want to access through an app, that just might not be their preference. The guides that are available in this, we have physical copies, we send them out in the post. So people do not miss out if they do not want to access this content through an app. We can provide a more physical version. We can talk through it on the phone. It's not a problem. Fab, and the next slide, please. And just to kind of, I guess, wrap up, I guess, our approach to support and what that might look like for an individual coming into our service. We have a phone line that's open 8 till 8, Monday to Saturday. We have 24/7 support lines and live chats available through our national website. They can self-refer, be partner agencies, police. It doesn't kind of matter in that sense. We want to have that broad outreach. We want people to be able to access services at a time that's right for them. So we kind of try and make that as versatile as possible. Fab. Thank you very much.
Thank you, Emma. I'm now going to hand over to Tracy from the Hampton Trust.
Good evening, everyone. Again, I'm sorry I'm not there. I'm usually on the island, but I'm working on the mainland today. Unfortunately, not having to get back to the Isle of Wight tonight. So we are the Hampton Trust, and hopefully you've heard of the Hampton Trust, but we've been around for nearly 30 years now, on and off the island in sort of variable times. My name's Tracy Kent. I'm the Director of Operations, and I work on the Isle of Wight, but I work across Hampshire and Southampton as well. So we are the commissioned service for working with individuals that are using harm in their relationships. So those that are perpetrating domestic abuse in their relationships. Next slide, please, Nicola. So we've been very fortunate recently to have been awarded the next commission service for the next 5 years, starting in April, and we're going to be combining our services with the mainland, so we're working very similarly across the board. But basically, we are providing services for males, females, any gender, sexuality, from the ages of 16 upwards. We've been on the island now. We were working in partnership with U-Trust for the last contract, and then we sort of went back to being independent, and we're sort of carrying on being independent. But we also offer the independent sexual violence service on the Isle of Wight too, and that's for any age and for anybody who's been affected by sexual violence, even if that's within a domestic abuse context, whether that's recent or non-recent. And we've been delivering that service for over 10 years on the Isle of Wight, and we're very proud of both services that we run. Next slide, please, Nicola. So I'm going to throw it out to you, and I don't expect you to answer. It's more to get you thinking. And if you consider the scope of the problem of domestic abuse across the UK, and we know that last year 3.8 million people were affected by domestic abuse. If you were to consider what percentage of individuals using harm were actually offered an intervention to address their behaviour, what would come into your mind? I'm going to give you a pause for thought. hopefully lots of positive thoughts there, but it's actually 1%. And these 1%, this has been come out of the domestic abuse strategy for perpetrators. And so after the Domestic Abuse Act in 2021, part of that strategy, part of the act was to formulate a strategy to deal with those causing harm in their relationships. But what was recognised that such a small percentage are actually offered a service. And so we've got millions of individuals moving from relationship to relationship, causing more harm, which is impacting on our children. A high-risk perpetrator of domestic abuse will move through at least 6 relationships in their lifetime. So if you imagine how many children are damaged, are affected, and grow up with adversity due to these behaviours. The majority of individuals we work with have a background of domestic abuse in their families. It's not a causal, it's not a reason for, because it's 50-50 whether somebody uses harm later or may become a victim, or may well be neither. And so it's all about what are those protective factors when somebody's growing up? What positive role models do they have in their lives, in schools, in their social networks? Can you move on, please, Nicola? So we're having to overcome barriers of years and years of not really understanding persons causing harm. And so the barriers not only for the perpetrators themselves, for those individuals that are recognising they want help, where do they go? It's a postcode lottery, and we are very fortunate in Hampshire and the Isle of Wight to have an incredibly innovative police force and innovative commissioners to enable us to deliver our services. And I'll talk about the services in a minute. But these are some of the things we're dealing with in terms of those causing harm. They're experiencing the shame, they're minimising their behaviour, they're justifying their behaviours, they're denying, they're fearful of consequences. Who do they disclose to? How do I even start these conversations? Societal perception of domestic abuse is that of violence and extreme incidences happening that we hear in the media. We may see it on TV, may see it in the papers. Wherever you may see it, we only hear about the extreme cases. But what we know is the behaviours that surround domestic abuse primarily are those of emotional abuse, coercive control. But also we have barriers with in professionals working on the front lines to be able to talk to those causing harm in their relationships too. We focus very much on the victims, quite rightly, for the reasons that we know, but actually, do we call those causing harm to account? Can you move on, please, Nicola? So we offer on the Isle of Wight currently, which will slightly change in April, our Pathways to Change is a recent rename. So we were called ADAPT, which was accredited domestic abuse prevention training, which to be more trauma informed and to try and encourage individuals to come and work with us, we used our current service users to consider an umbrella name for all of our interventions that would be more accessible. So we have Pathways to Change, and underneath Pathways, we have a range of interventions to deal with all typologies of perpetrating. And so we have long-term group programs, we have one-to-one sessions. We work with females that are using reactive behaviour in their relationships or harmful behaviours in their relationships, and we work with 16 upwards. It's very hard to target 16 to 18-year-olds, which is one of our focuses moving forwards, especially the next contract, but it still is now. We're trying to formulate increased pathways for those referrals and to come in and feel they can access individual services. They wouldn't be coming onto the group work, which is you need some sort of emotional intelligence to participate in those programs. We also have Foundation. So Foundation target hardens individuals that are causing harm in the relationships but not coming into any police criminal justice intervention. So they're getting no further action time after time, or they're moving from relationship to relationship. So we will work with the police to target individuals that are coming to their attention regularly. And then what we would do then is go out with the police, visit them, try and make contact with them and offer them services and support and stabilisation. to minimise the harm that's happening within their relationships. We also have Project Cara, which is now a national, and it's named by the Home Office as the gold standard intervention for those that are being arrested for first-time domestic abuse. And so they will get a conditional caution to attend 2 sessions of Cara. And it's not a change programme, it's not behavioural change, it's an awareness raising process to help somebody recognise what domestic abuse is, what's the impact of it, and what's their personal risk factors. And we've only just started groups, even though we've been running in Hampshire since 2011. Group work has just started on the Isle of Wight, which we're really happy about, because we don't want to encourage individuals to have to leave the island to access support. We should be able to do it here, and then we can move them on to our longer interventions as much as possible. Underneath all of our interventions, we have victim contact. So we have an integrated victim support service that is there to navigate the risk and to move those being harmed into services like U-Trust, victim support, whatever service that they require at that time of need. Can you move on, please, Nicola? And this is sort of how that works. So we've got mentors. So we've got individuals that have finished the programme and recognise how it's changed their lives so much that they want to volunteer their time to support other individuals coming through the programmes and take some of the fear away from coming into a group work intervention, for example, know what to expect. But also they help with relapse prevention. They're on the end of a phone not 24/7, but they will answer as soon as they can, and to man the phones, but the line is open. Sometimes people just like to offload. We do pre-group work, we do motivational work, stabilisation, intensive case management. We have we work with the police around disruption strategies and interventions around Project Foundation. And like it all says, it's basically our focus is the well-being and safety of those that are being harmed with their children, but also the perpetrators themselves. The biggest risk for those causing harm is that of suicide ideology, and we know suicide is a huge issue on the Isle of Wight for young men specifically. Thank you, Nicola. So just to give you some benefits, behavioural change isn't just about changing somebody's behaviour, it's about what intelligence we can share. We should never work with domestic abuse in silo. It's an integrated way of working with multiple organisations to share the risks, share information where we can, and support other professionals to really understand how to deal with individuals. I do a lot of webinars around engaging with those causing harm, and I get a lot of calls from doctor surgeries and people on reception sort of asking questions around, what do I do with this person? How do I even instigate a conversation with them? So it is all about risk management and coordinated community response. And we use our service user feedback to really move our programmes, our interventions to be much more holistic and service user led. Can you move on, please, Nicola? We created a Dare Aware training course. So what we wanted to do, and it quite aligns with the strategy that was talked about today in relation to domestic abuse, working with young men in schools around their misogyny and around their behaviour. But what we recognised to help professionals working on the front line, we created a 3-module training process that helps individuals understand how to identify those causing harm, how to engage with them, and then and what services they can be referred into. So this has been a national initiative, and we've trained nearly 2,000 professionals across the UK and the Isle of Wight and Hampshire. And that is also included in our new commission service that will start in April. So we will be rolling that out again as free. But we also do lots of co-location into services. We want to be able to act as consultants for frontline services, no matter where you are, to help support workers to sort of think about how do we include the perpetrator, the person causing harm, into the conversation. Thank you, Nicola. That's me done in a nutshell.
Fantastic. Thank you, Tracy. I'm now going to hand over to Kelly Diamond, who's going to talk about safeguarding.
Good evening, everybody, and my apologies, Chair, for being slightly late to the meeting. My name's Kelly Diamond. I'm the Partnership Manager for the Isle of Wight Safeguarding Children Partnership. And here today really just to talk about some of the work that we've been doing recently, some of that where we've had domestic abuse as a key cross-cutting theme for our partnership, and also to highlight areas where we've worked in collaboration with some of the speakers that we've had today and with the Domestic Abuse Partnership Board. One of our key priorities that we've been working on this year is the Children and Young Persons Domestic Abuse Referral Pathway. We already knew that there was the adults version of the domestic abuse pathway, but we worked with the Domestic Abuse Partnership Board and consulted and approved through both boards, so the Domestic Abuse Partnership Board and the Isle of Wight Safeguarding Children Partnership, to have a domestic abuse referral pathway, but also to sit behind that some of the guidance that sits behind it. So it goes into some of the a kind of short description of some of the commission services that we've heard from today, and it's got a few things like a few tips if you're speaking to children, if they've perhaps disclosed a concern, or if you're working with families, and obviously links to and highlights where to go and where you should refer to through to our multi-agency safeguarding hub if you've got concerns about a child. We've also looked at the joint targeted area inspection on the multi-agency response to children who are victims of domestic abuse. This was it's colloquially as the JTI, the Joint Targeted Area Inspection. This was the main focus of the inspection back in autumn 2024. And as part of that, we, as a multi-agency workforce, looked at the evaluation criteria for the JTI, and then thought, as a multi-agency workforce, where we were in relation to that. So we kind of benchmarked ourselves against that evaluation criteria. From that JTI and looking at the multi-agency response, we then came up with a series of recommendations, which has kind of informed a lot of the other work that we've done this year in collaboration with the Domestic Abuse Partnership Board. So as part of that, we had a tabletop audit as the we recommend there be a tabletop audit in relation to multi-agency response to children as victims of domestic abuse. We thought about how we might be able to use the Domestic Abuse Board Partnership, the Victim and Survivors Voice. We looked at thinking around how we could disseminate the Children and Young Persons Domestic Abuse Referral Pathway, and also how we could promote practitioner engagement in a domestic abuse learning and development offer. So as part of that, and I've linked each things on the slides here, we expanded the learning and development offer. So the learning and development offer now extends to 15 courses, and these are in relation to both safeguarding children and safeguarding adults. These are progressed by our Workforce Development Group, which is a joint adults and children's group, and then the Domestic Abuse Partnership Board is a membership of that group. And it's a really important part of our offer. In fact, it was something in the recent Local Child Safeguarding Practice Review of Sarah Sharif that the engagement, we really need stronger engagement in multi-agency domestic abuse training. So it's really timely that some of our learning and development offer has now been increased recently. Can I have the next slide, please? Thank you very much. We also had a part of our work that we've been in this year, the Safeguarding Children Who Are Victims of Domestic Abuse Practice Week. Now, as part of this practice week, it was done in collaboration again with the Domestic Abuse Partnership Board, and it tied in with the 16 days of activism on gender-based violence. So as part of this week, we kind of themed them out each day. So the first day we looked at the introducing the Isle of Wight Domestic Abuse Referral Pathway. On Tuesday, we looked at supporting support for children and young people and what support was on offer and available. On Wednesday, we had a learning and development day. And as part of that, we really focused on the introduction to the impact of domestic abuse on children and young people. On Thursday, then we looked at kind of key messages from wider national practice, and as part of that, we looked at the National Child Safeguarding Practice Review Panel's review, where they did a review into multi-agency safeguarding and domestic abuse. And then on the Friday, we launched our domestic abuse safeguarding theme overview pack, which is the next bullet point here, and again linked through in the PowerPoint slides. And as part of well, we call them stop packs, so for safeguarding theme overview pack. But it really highlights some of the facts and figures as a call to action. It promotes the domestic abuse referral pathways, both for adults and children and young people. It promotes the multi-agency training that's available, and we've had separate leaflets that have gone out, and we've continued to promote that training. And then only very recently, in fact, last month, We had our thematic audit, which considered the multi-agency response to children as victims of domestic abuse. And this was undertaken by members of the Performance Quality and Assurance Group for the Isle of Wight Safeguarding Children Partnership. But as part of that, the Domestic Abuse Partnership Board sat as part of the panel members. And as part of the kind of thematic audit, I mean, we don't have all the findings yet. It will be go to our board for approval soon. But as part of the audit, we did a review of the multi-agency response where domestic abuse was a feature for 6 children. So as part of this, we had a multi-agency panel and we looked into a kind of deep dive into the circumstances for 6 children, starting to look at effective practice and areas of development and consideration that was identified. We also looked at a review of the data for a number of children accessing the Commission support services for domestic abuse. It also included observations of the Isle of Wight Multi-Agency Risk Assessment Conference and the High Risk Domestic Abuse Conference, sometimes colloquially known as MARAC and HERDA. We also, as part of the audit, had a practitioner confidence survey, and this went out to multi-agency representatives. We were really, really pleased to see there was 142 responses from right across the Isle of Wight from a really wide range of agencies. And there were some really positive findings from that. We kind of saw from the audit findings, 85% of those who participated in the survey felt confident or very confident in identifying children as victims of domestic abuse. And that was really a key point for us as part of the Domestic Abuse Act of 21, knowing that children are victims in their own right. It was really important that we wanted to see if that was understood and reflected across the multi-agency workforce. 87% of the respondents also felt that the multi-agency collaboration when responding to children affected by domestic abuse was effective. I thought it was a really encouraging finding. We also, as part of the audit, looked at feedback from children and families who've experienced domestic abuse, support Commission services on the island. And it was a really powerful part of the audit. We had feedback from a selection of families, and they're ones that are currently receiving support, but it was such a powerful part of the audit, and we really wanted to have that kind of wider reflection about how we could bring in the voice of victim and survivors into our work further, which takes me really nicely onto the last point for my slide today is around our conference. So as with all things, we're trying to make sure wherever possible where we've got cross-board priorities so that we can make sure that we come together and collaborate on those. So the conference that we have going ahead in February is a joint conference between the Adult Safeguarding Board, the Children's Safeguarding Partnership and the Domestic Abuse Partnership Board. And as part of that, we're looking at a kind of every voice matters, a whole family lens on domestic abuse. And as part of that, we've got 2 expert keynote speakers that will be coming to take part. One will be doing a keynote speech at the beginning of the conference, and one will be facilitating the day. And it was really important to us that we tried to get a further reflection on victim and survivor's voice and how that's embedded in practice. So we've been really excited because the Domestic Abuse the Victims Survivors Voice Forum, they will be part of facilitating on the day, and they're bringing, so we're going to be looking at case studies and looking at some really key Isle of Wight examples to centre the practice on, and they'll be working with one of our keynote facilitators as well. And because it was a hugely important point to us that we use that forum to make sure that those messages go across, those key messages they want to share across to frontline practitioners. So that's, unless there's any questions, that's kind of a bit of a reflection from the Safeguarding Children's Partnership. I am just going to talk to one slide from the Safeguarding Adults Board, but you'll have to forgive me in that it's not my area of management, but I'm happy to take any questions back that may arise. But the Isle of Wight Safeguarding Adults Board very much kind of look at where their strategic alignment, so that if there's a unified approach protecting all adults at risk. The Every Voice Matters conference is what I've just spoken about previously, and as I say, is very much a kind of joint conference where we're getting representation from frontline practitioners right across the adults, children's workforce, but also those that cover both. And there's a really wide variety of agencies that will be coming right from some of the services that we've talked to today. We've got guest note speakers from our commission services, but we've also got practitioners from things like housing and our frontline family hubs and things. We've got cross-board representation, so that between the Domestic Abuse Partnership Board, the Adults Board and the Children's Board, we all represented in each other's boards so that we can take any of those key cross-cutting themes and priorities and actions forward. And also just some, what comes down to so much really is that strong professionals relationship, that real open communication and collaborative approach, working across adults and making sure that we do, when we do find those key themes, that we do make sure that they are, that, you know, the learning from those goes across both boards. And as I say, it's not my board to manage, but I know that Laura really wish she could have been here today, and has said if there's any questions, then she's more than happy to provide a response to those. I think, Nicola, that's
Brilliant, thank you. And finally, we've got Andy.
Thanks very much. Good evening, everybody. Andy McDonald, Isle of Wight District Commander. Coming towards an end of the presentation, there's a lot of data there, and I'm pleased that the bits I'm going to raise here haven't been spoken about before, but I think it's really important just to bring some data in start, because actually it brings a bit of perspective on the challenge we have in relation to domestic abuse. So in 2004, there was 108 domestic abuse homicides in the UK, 262 DA-related deaths, including suicide. Only 20% of victims reported domestic abuse to the police. On initial attendance at a new domestic abuse incident, there's often been over 30 incidents of domestic abuse before that gets reported to the police. Locally here, in terms of crime demand, 20% of our current demand is domestic abuse related, and that relates to a 16% on a national average. So we've got a higher percentage of domestic abuse crime than we do have nationally. So in relation to where we are locally, as a result of the demand we have in relation to domestic abuse, I have currently had 3 district priorities, and domestic abuse is one of those. Being a district priority means that I have increased resource which is put into our domestic abuse response. Comes along with that is greater scrutiny on a daily basis, but also on a monthly basis with our medium and high risk victims and perpetrators. In relation to domestic abuse, what I would say in relation to crime reported, it's only one of 2 crime types which actually we look favourably on our crime figures increasing, because we know it's underreported. The other crime types, hate crime, every other crime we're looking to reduce. But reported crime often isn't a really good metric in relation to domestic abuse. I find that in terms of holding and bringing my teams to account, actually, is our repeat victims is really important, and how we can reduce our repeats. That's tricky on the island because we have seasonal variation. We have an influx of people coming over to the island. So monitoring our repeats is quite tricky, but also our solved crime rate is also really important. And currently here on the island, we are solving 12% of all our solved crime in relation to domestic abuse, and that's higher than our 3 other areas in the north, south, west and east in my force area. In relation to our current force priorities in relation to domestic abuse, they're pretty simple. It's about prevention, it's about supporting victims, and it's about perpetrators. But what I would say, in each one of those pillars, it's all underpinned with a really strong multi-agency response in relation to that. Domestic abuse sometimes gets looked at as just a police responsibility, but actually it's the key to it is about actually bringing all the agencies, a lot of what you've heard about here already. In relation to prevention, we have as a law enforcement agency, obviously we go primarily down the criminal justice route, but we do have other tools at our disposal. So domestic violence prevention orders, we have right to know and right to ask. But one of the things in relation to the prevention, for me, is really important. It's about the hidden victims of domestic abuse, and that's very much children. And here on the island, we're really fortunate that we've got a new multi-agency safeguarding hub, which Ashley introduced with his teams. And I'm really fortunate that I'm able to bring them into my morning meeting. So we have those really fast, joined up conversations, particularly when it comes to safeguarding, particularly around our high risk perpetrators that we have custody at that moment in time. Victims is really important in terms of leaning into the support agencies. We know that in relation to domestic abuse, there is elements of trust around the criminal justice system and the police previous response in relation to this. We've got to work hard to improve that, particularly with our repeat couples in relation to that often come to notice. I'm just going to highlight 2 cases where in terms of multi-agency, where Paragon and their use of independent domestic advisors have been really key. So we had a non-intimate couple, so a mother and an adult son, hundreds of reports to the police. We went through a repetitive cycle of putting before the court custodial sentences, but we could not break that cycle. Paragon, through some really detailed engagement, managed to gain the confidence of that victim and secured a off-the-island placement in a hospice, which in terms of the cycle that was going on there, it was pretty existential. Another case in terms of that is quite recent, we had a truly awful case of stalking, 15 reports to the police, victim didn't want to engage, no trust in the criminal justice system. Paragon's independent domestic advisors then came in and managed to engage, gain the confidence, explain the criminal justice process, bring the victims hub, and actually in terms of where that victim is now, their life has moved on, truly transformational. In relation to perpetrators, obviously criminal justice route is our primary response in relation to that. We know there are problems in relation to the CJU system in terms of court wait times there. So it's really important that we lean into our support agencies available. But also, as referenced there from the Hampton Trust, there only 1% go on to sort of perpetrator programs. So the Operation Foundation is managed by the Hampton Trust, but supported by the police in terms of safety and planning. And we actively go and engage. It's got a really successful rate in terms of where we have those perpetrators that want to engage, want to change. They have that support that sat behind them in terms of breaking that cycle of abuse. Move to the next slide, please, Nicola. The way we deliver domestic abuse, and what's really important is about trying to deal with domestic abuse in a day. We know that when we get into stages of releasing perpetrators under bail or released under investigation, they're far less likely to get the outcomes that we want in relation to it. And it's really key pivot points in relation to this. And we have the rapid principles which we follow there. But actually the response is really key. Having that qualitative, victim-focused response by my officers is really key in terms of trying to engage our victims, building that trust and confidence up with our victims. We have the use of technology. Body-worn video has quite significantly changed the way we can present evidence to the Crown Prosecution Service, and we're making more use of what we call evidence-led prosecutions, where we don't have the support of the victim, but we are able to present a case backed with information that the Crown Prosecution Service will pursue perpetrators through the court system. Investigation is really important from my perspective in terms about getting that right investigator, investigating that crime from the start. Is that a crime which warrants a detective to have a look at, and 90% of all high-risk domestic abuse is investigated by detectives on the island. If I move to the final slide, please, Nicola. And this slide is really important because actually domestic abuse is so important. We can't stand still in this area, and actually we've got to keep on learning and improving the way we deliver our services here on the island. And we have a real intensive scrutiny panel here, which is held monthly. We have our partners come in and offer that critical friend perspective on how we are delivering our services, but also from a wider force, we have peer on peer in terms of areas, looking at other areas in here, because actually we know in this area we can't stand still. We've got to keep moving. One of the areas I've been really proud of over the past 6 months, so in relation to children, when we go to a domestic abuse incident, we capture that voice of the child, and the Isle of Wight is by far the best district within our force area. We've still got work to do, but we've made significant improvements.
Could you just go back to the slide and just take some of the stuff that's, so explain the use of the RRRM? Yeah, is that okay?
Sorry, yeah, of course, absolutely.
I think this is, if you had a lot of police officers in the room, they completely understand, but we do have members of the public online watching as well. Thank you.
Absolutely, yeah, please. You might go back. That one there. Oh, I see. Sorry, apologies. Right, okay. So, VCM VNA. So that's victim contract. So when we go, we take a report from a victim, and it's about that contract we make with them to how we're going to keep in touch with them. Do they want to be contacted by email? Do they want face-to-face? How regularly do they want that contact? When we go to a V&A, that's about the needs of the victim. Do they have enhanced needs? If their matter goes to court, are they going to need screens? Are they going to need video live links? So it's about looking at the victim and what we can offer them to support them through the criminal justice process. The RRM form is essentially a risk management form, and that's it goes through a detailed set of questions which enables us to establish the risk in relation to a domestic abuse incident. Body worn video is, as it says, and CCB is coercive controlling behaviour, so often very linked in with stalking, but we know those perpetrators that commit coercive controlling behaviour in terms of that high harm, high risk. That's one of our significant indicators on our domestic abuse homicides a risk assessment, as it were. Sorry, apologies for the acronyms there. Ashley's going to, because he hates acronyms, there's lots of press ups there. And my upper body is going to be like, pulsating.
It'd be even worse if you couldn't answer it.
Absolutely.
Thank you.
That's it. Thank you very much.
Thank you, and thank you, Chair.
Thank you. Right, this is a scrutiny item, as we know. I need to remind you all that we have two items this evening, that we have the scrutiny part where we can question, and we've listened to the presentation this evening. Can you just turn your speaker on? So if we could have some questions would be lovely, and this is the scrutiny part of this, so anything that's of the services that you've heard, and then we will move on, and we can ask you, you can either sit through the next part of the meeting or leave when we get to the next section. I will make it very clear, but it is an awful evening, so I don't expect you to stay any longer than you need to, of which we will then ask Nicola to introduce our domestic abuse strategy that is driven by the council, because we do have a part of the evening this evening that you do have a decision making to make this evening, which is to look at the domestic abuse strategy. So I will try and control this, so we do have two sections, and we remember the decision part of the meeting that we do have to move to. So, councillors, who would like to ask the first question? Councillor Nicholson, and then if you raise your hands, I'll make sure you all.
Yeah, an horrific subject, and it sends shudders down your spine to think of any poor soul subjected to domestic abuse. Whether, I mean, children is just criminal, but I think most of the public think immediately of women being subjected to domestic abuse, but I understand that men are also subject to, and I find it difficult to imagine how that is, but I beg it that happens. But in the paperwork that we had, there didn't seem to be any mention of that, and I was thinking, if you were unfortunate enough to be a man subjected to domestic abuse, reading the literature that might be publicly available, if there's no mention of cases like that, they might think that it's not a service for them. Just an observation, I mean.
Thank you, Councillor Listener. I'm going to bring Nicola in first, if that's okay, and then you can refer to anybody who'd like to bring in to answer that question.
Thank you, Chair, and thank you, Councillor. We've worked really hard throughout our documents to try and use gender neutral language, because we are aware that though this is a gendered crime, there is a significant minority of men on the island who are subject to domestic abuse. And we do try to use that gender neutral language, but I'll just pass over to Jane, if that's okay, who can talk about how Paragon support male victims on the island.
Thanks, Nicola. Yes, we absolutely do support male victims on the island. So our referral stats show that in the last year, 338 referrals into the service were for male victims on the island. And actually, as it currently stands from last week, we actually have we're currently supporting 70 male victims are open to support as it stands. So we most definitely do support males. They are being referred to us both from agencies and self-referrals. Again, we do tend to make our literature quite gender neutral, because we support adults and children and tend not to have gendered language in there. But it is important that men are aware that we do support, there is a service for them on the island.
Thank you. Councillor Lever.
Thank you, Chair. I've got a few different things. I'm trying to formulate them in my mind, but I'll start with the intervention for perpetrators. I think it was Hampton that was pushing on that. Was the 1% that was nationally, was it? And do we know, in terms of the intervention for perpetrators, what percentage of those that do take the intervention then end up reoffending? Like, how successful is that intervention? Do we know? Sorry if that was covered and I've just missed it.
No, thank you, Councillor. It's a really interesting question, and I'm going to pass over to Tracy, who's got that really detailed knowledge.
Hello, yeah. So the 1% was nationally, and I think it's very hard to ascertain the actual outcomes post intervention, and I think the way we evaluate sort of outcomes, and there was a particular project called Project Mirabelle, which has been sort of the largest evaluation around interventions for those causing harm in the UK, and the Hampton Trust were part of that evaluation. It is accessible, but I'd say the majority that go through the programs, if it's very hard to remain play lip service, so to speak, because our facilitators are trained to sort of recognise where somebody is not demonstrating accountability. And so our programs are long because it takes a long time for them to change their behaviour. But it's also, we don't get any data post end of intervention, but those that end up working with us tend to stay with us. But our feedback comes from the partners, the ex-partners, the professionals working with them. And that can be whether they've moved from child protection, their family, the child and the family's moved from child protection to child in need, or feedback that the individual is now working better with the social workers that are involved in their case, maybe. It could be that the police aren't seeing them so regularly, and that's easier to identify on the Isle of Wight because we're in regular contact with the police and they sort of ask, I haven't seen so-and-so for so long. So it's very hard to demonstrate outcomes. But I'll just, I guess I wouldn't be working in it for so long if I didn't believe that it does work. But it's about that coordinated response and the information sharing and the intelligence that we gain from it that really proves that and demonstrates how we can work together to sort of end domestic abuse. I hope that answered your question.
It did. And my follow-up was just how, I guess, the ways that we improve that 1%, getting to that place. How do we do that?
Okay, we've got to hold perpetrators to account. And so even the MARAC system, which MARAC is multi-agency referral and assessment and conference. No, it's not risk assessment conference. Somebody put me right. But MARACs are focused on the person who is being harmed, which is brilliant and great and much needed, that multi-agencies will come around to sort of target hard in that individual and find ways to keeping them safe. But actually the person who's causing the harm is walking off scot-free and isn't even aware that he's being scrutinised. And so we need to change the culture of how we deal with domestic abuse. We need to partner with the persons being harmed and listen to what they want, listen to their risk and understand their risk, and then hold the perpetrators to account. But it's about how we approach that and how we give individuals on the front line the confidence to actually have those conversations, but doing it in a way that's going to bring them on a journey. So we used a lot of motivational interviewing to bring them on a journey of change. But it's wider. It's a huge culture change that we need to consider and be able to approach confidently.
Thank you. Can I bring in Councillor Redrup?
Thank you, Chair. I just want to say a huge thank you to all of you for coming and for giving such great detailed presentations. It's really encouraging to see what's happening and really interesting. Some of the feedback that I get from residents when I talk to them about this subject is sometimes the confusion about the pathway and what's open and what they qualify for, or where they should go. So I'm glad that this is recorded so I can point them to this video so they can watch in detail about all the different options and all the different things that happen on the island, which is great. But with that in mind, one common thing that I've been asked a lot is about particularly about counselling and mental health support, and particularly for those who might not fit the medium or high risk. So my question is probably going to be for Emma about when you have someone that presents to you who really needs that mental health support, perhaps counselling. What do you do in that situation? Is there something that the Care Hub can offer, or is it something that you refer elsewhere?
No worries at all. Thank you. This is probably going to be a bit of a joined up answer, and I hope we'll kind of show that linked up and joined up working. So if someone was to come into our service and once we've completed that needs assessment, there is identified that counselling or therapeutic support is needed, we will have to look to refer into partner agencies, and for the island that we would look to kind of speak with, say, Paragon around what the delivery of that looks like, or kind of if maybe they want to engage with more NHS kind of based counselling and therapeutic support services. I think in the world of mental health provision as well, there are also options available. So we just want to be in a position where we can talk through what that looks like. Are they looking for something domestic abuse specific or something broader? And within that, we don't have a contract kind of to provide that therapeutic support, but we absolutely would look to explore those options with them.
Thank you. Can we bring in, I think we can bring in Jane, please.
Yeah, I'm happy to pick that up. So within our commission contract, we do have we do provide counselling. The capacity for that is very small because that's what's commissioned. So individuals can be referred into our counselling service. It's not based on their domestic abuse risk, because we would normally refer individuals into counselling at the end of the service. So we would hope that most victims at the end of receiving a service would be standard risk anyway, or very kind of lower end of medium, because mostly it will be historic. So we do have provision. We're only contracted to provide 15 hours a week of counselling. So the demand for that service far outweighs our capacity. Currently we have over 100 people waiting for counselling on the island, and referrals at the moment are currently closed because we are awaiting funding decisions from the OPCC, who funds the counselling on the island.
I can guarantee that Councillor Redrup has got a follow-up question to that.
Yeah, absolutely.
Thank you. Just quickly, you said OPPC, Office of the Police Crime.
Yes, Office of the Police and Crime Commissioner.
Just
sorry.
I heard that right. Yeah, that's fine. Considering the status of the Police Crime Commissioner might be changing, does that affect your, I've just forgotten what I was going to say. Commissioning, yeah. Does that affect the commissioning for that kind of service going forward?
That potentially, yes. With our funding from the Police and Crime Commissioner, which comes directly from the Ministry of Justice, currently as it stands, it's always short-term funding, so it's yearly funding, which isn't particularly helpful. So yes, every year we wait. They don't just fund the counselling element, they also fund the majority of the high risk domestic abuse element for the IDVAs as well. Yes, we wait every year to find out the amount that will be awarded. So moving forwards, that potentially will impact on our delivery.
Sorry, Chair. Thank you very much. I just want to highlight that point then, that it seems that when we are perhaps later on looking at the strategy and we're thinking about implementation and gaps, that mental health support within the whole is one of those gaps that probably needs addressing. Would you say that's correct?
Yes, absolutely.
Thank you. Kelly, I think you wanted to add something. Kelly Diamond, please.
Yeah, it's just a really quick one. I'm sorry, I wasn't sure which councillor said earlier about highlighting to people in the community around domestic abuse services and where to go. There is a page on our website, on the I Like Safeguarding Children Partnership website, for parents and carers, and there's a domestic abuse tab on there, and it just gives an overview of domestic abuse and organisations that can help, and that links straight through then to Paragon and Hampton Trust. So it's just a kind of port of contact, really.
Thank you. Can I bring in Councillor Jarman next, and then Councillor Quirk?
Thank you, Chair. I really only had two questions. First of all, I'd like to add my thanks to all the people that have contributed here. It's very useful to see everything as individual facets, but collectively to see them helps to understand how they join up. So, and they're also unusual that as a collective service business, success would be defined as having no customers, which is not very typical of many enterprises. The question I had is, how do you track the contribution your activities deliver towards that goal of ultimately having no customers, which would be the paradigm?
I'm happy to start and then let the others come in. I mean, that's very difficult. We would love a society where there weren't any victims. Our role in that is actually supporting victims, or when they become victims. And one of our main aims in our service is to ensure that they don't become repeat victims again, that they're able to recover from their experiences and move on through life and live a life free from abuse, because they're able to identify and have the tools and resources available to them to be able to identify unhealthy relationships. The other type of work we do is about raising awareness of domestic abuse. That's why we run the Dragonfly programme. I think it's really important that if there is more understanding about domestic abuse and how it impacts individuals, then that will also in turn hopefully support those that are perpetrating domestic abuse to seek help at an earlier stage, and also for victims to access support. The support we deliver in schools is very much around prevention and early intervention, and that's really important. And obviously the government have announced today that there's going to be a change to the curriculum, which I absolutely applaud, because that needs to happen. We need to be educating children and young people what is acceptable in relationships. Unfortunately, from the rates of our referrals, which since, as I said, since 2019 they've actually tripled. That we're not there yet. But I think the more referrals we're getting in, it's difficult to know whether it's that there is more abuse, or whether there is just that people are now identifying abusive behaviours better and seeking support earlier.
Thank you. Can I bring in Laura Johnson, please?
Yeah, thank you. Just in relation to the councillor's question, I think what we've asked our commissioned services to do is almost the opposite from the question that you've posed. So we've asked our commissioned services to reduce barriers to access, and much echoing the police commander's comments earlier, we're actually seeing an increase in referrals as a positive. And there's a number of metrics kind of building on from what Jane has spoken about that we use to measure that. And we look at that in a range of different ways, broken down by kind of age, gender, ethnicity, disability, but also other metrics such as repeat referrals and that prevention bit, as well as a really strong kind of feedback from service users. And I think once we get to a point where we can look at the wider systems work around the imbalances in society, and therefore in relationships, which is what we know underpins domestic abuse and is addressed quite strongly within the strategy that was launched today, we can probably then start looking at it from the opposite end of the lens, if that makes sense.
Thank you. Nicola.
So I just wanted to add, we're really fortunate on the Isle of Wight as well, because across the country nationally, only 12% of domestic abuse teams sit in public health. And so having Kate as new DPH on the island and having that broader prevention lens, I think that's where we'll start to see those real changes. I feel really fortunate to have Laura and Kirsty and the Commission services in our team, because we can build those stronger links with drugs and alcohol, with mental health, with our children's services. We've got Peach in schools, for instance, and having domestic abuse in public health is absolutely where it belongs, but we are in a minority and we're very fortunate in that respect, I think.
Thank you. I'm just going to read my little list out of people I've got for questions, and I will start to draw this section of the meeting to a close. So I've got Chris Quirk, I have Councillor Gladwin, and I have Joanna. So if you'd like to ask a question after that, could you just and Councillor Lever. Okay, so Councillor Quirk.
Going back quite a few years, before I came to the island, I was chair of governance of a 10th form of entry co-ed secondary school in West London. And we had issues, a small percentage of students, but very impactful on families, where the abuser was a teenage boy abusing a single mum or abusing female siblings. And that was definitely a measurable issue in West London 22 years ago, before I came to the island. Is it an issue here on the island? And if so, how does that fit into the work that we're doing here?
And thank you, Councillor. I don't have the statistics at hand. I'll reach out to colleagues who could tell me, but I can see hands in the, Kelly. But non-intimate partner violence and domestic abuse is really key. The definition of domestic abuse that we work to on the island is that much broader relationships. It's absolutely not limited to intimate relationships. And the example I thought that Andy gave was really powerful around that that parent-child relationship as well. So we absolutely do include cases like that in our services. Kelly, I can see your hands.
Yeah, just say that Bernardo's on the island. They do a 9-week program, which is child and adolescent to parent violence, which I think is they're not here today to present, but that is something that helps to go some way to addressing and supporting those children who are showing harmful behaviours towards parents or otherwise.
Andy.
Just reiterate what Jane said today with the announcement from the government in terms of the change in focus there. It certainly is absolutely an issue, you know, and there is definitely a preventative part in terms of peer-on-peer relationships and what constitutes a healthy relationship. So that part, the schools have a really key part to play in relation to this.
Thank you, Councillor Gladwin. Oh. Ashley Wood.
Can I just add, as no one else has raised it, I think there is a changing need amongst children in this. So, for example, I think the internet is playing a big role. I think some of the material that children are watching on a very regular basis from a very young age is influencing their behaviour. And there's growing evidence that is impacting children's views about what is a healthy relationship, what is appropriate or isn't appropriate, etc. And there are a number of examples of where this has played out in a way that we wouldn't want it to. And I think that schools have a very significant role to play in this. And I really welcome the news this morning about the approach around misogyny in schools and how that will be embedded in the curriculum, because on the island, it's definitely a growing challenge, and it's something I actually spoke with head teachers about at the beginning of this term, where we had a head teachers forum to urge them to make sure that they include it in their work with children about healthy lifestyles, healthy relationships, etc.
Thank you. And Councillor Gladwin.
Well, there's still a huge amount of stigma against sort of coming forward with domestic violence and abuse, and I was just wondering what steps were being taken to overcome that, bearing in mind that a lot of the victims have grown up with domestic abuse and everything else, and there's sort of like the Stockholm syndrome that you want to protect the abuser and don't want to go against them. So I was just wondering what steps you were taking to overcome that huge amount of stigma.
Shall I bring Nicola into who to get to answer this?
Thank you, Councillor. Absolutely. One of the reasons we were so happy to have this opportunity tonight is because it's not a subject that's talked about enough. And I think talking about it is the key way to break down that stigma, particularly for male victims as well, when we're talking about groups who aren't necessarily represented. And it's absolutely key. I wonder whether, Jane, the Dragonfly training might be a really good thing to reference here. And I can see that Emma's put her hand up, Chair, if however you'd like to run it. Sorry.
Thank you.
Yeah, I'm happy to talk about the Dragonfly. I think, there is a lot of stigma for victims, and, there are lots of victims who will not disclose and will not come forward. I think that our Dragonfly programme really helps to support disclosures of domestic abuse. It's free and it's for anybody in any community, and not just for professionals working within local authorities, etc. This is your hairdresser, this is your dentist, this is your vet, your news agents, WIs. This is about in educating the community to recognise domestic abuse, because most people will know a victim or be concerned about somebody in their relationship, but struggle to really ask the questions appropriately and offer that supportive ear, and then know what to do if somebody does disclose. So that's where the Dragonfly steps in, and it gives individuals that information, and that's why we're really proud to run that on the island, to really educate communities.
Thank you. Councillor Yabwin, have you got a supplementary question?
I don't, thank you.
I'll pass over to Joanna from Healthwatch with her question.
Thank you. And I'd like to thank the Chair and the Vice Chair for putting this on the agenda, because it's such a critical issue. I've got two quick questions. So one question for Paragon regarding your referrals. So how many people don't reach the threshold for your service that are referred to you? And are all of those people signposted to other services? Because I think it's really important that people, all people who reach out for help are given some support. And the other question was around what happens if either the perpetrator or the victim has dementia, given the demographics on the island. How is that situation managed differently as it should be? Thank you.
Joanna, I remember often why you remember this committee, and that is such an excellent question. I think Jane Hardy was coming in, weren't you? Thank you.
Yes, I haven't got the data with me regarding those that don't meet criteria, but it's very few that meet criteria for our service. But if somebody doesn't meet our criteria, that would mean that they would be standard risk. And if they are standard risks, then we would either offer them a referral to victim support, to the Victim Care Hub, or we would offer them therapeutic group work. So, we don't turn people away. They are given options on what they would like to do, and we'll support them with that. The second question regarding dementia, we would support the victim as a whole, and that includes, the family unit. If perpetrator or victim has dementia, then that's a safeguarding adults referral that we would make, and we would work closely with the safeguarding adults and adult services to ensure that the safety of both the victim and the perpetrator.
Thank you. I'm going to bring in Councillor Lever, and then the final questions will come from Councillor Redrup.
Thank you, Chair. Just quickly, in the pack, it says an estimated 23% of the individuals on the Isle of Wight subjected to domestic abuse have their experience of abuse recorded as a crime by police. Can I don't know if I've just misunderstood that, but what's the Why is it 23%? Why is it not higher than that? Or is it just people aren't reporting? What, does anybody know?
I'm going to bring in Laura first. Laura Johnson.
Yeah, I'm sorry, I'm not going to be very articulate because it involves data and intelligent speak. But essentially, the figures that we know locally and the figures that we know nationally are taken, and then that has extrapolated and looked at our population, and there's a projection of the hidden number that we would expect to be seeing, and that is then looked at as a whole. And it's estimated that only 23% would then be recorded by the police. So it's not actually a reflection of police practice, but it's a reflection of the fact that not every person necessarily recognises abuse in their own relationship as a criminal issue, that there are many kind of hidden victims, and that not every victim chooses the criminal justice system as part of their recovery journey.
Thank you. Councillor Redrup.
Thank you. Andy, I just wanted to say thank you for your presentation and particularly talking about the work that you do with other agencies to improve the trust in the police. I think that's a really key takeaway from tonight is the recognition that that trust needs to be built and actively working towards that. And that's really positive. And would hopefully encourage people to come forward that they will be believed and trusted. Alongside the news that we had today from the government about the violence against women and girls strategy, we also had the recent news about part 2 of the Angelini report. And I was just wondering what sort of key learnings from the first part and the second part that the police locally are taking.
Thanks very much for your question. So yeah, Op Angelini is really sort of sub-priority for here locally. So here on the island, if we get an Angelini-related crime, and for those that aren't aware in relation to Angelini, it's the sort of predatory behaviour type crime. So the voyeurism, crimes where we get sometimes reported at schools with males that are sort of hanging around and sort of like in suspicious circumstances, but also to more serious sexual violence exposure. They are scrutinised every day, and they have a detective oversight here on the island just to make sure we get appropriate sort of like traction and response in relation to those particular crimes.
Thank you. And that I will draw this scrutiny part of the meeting to a close. Thank you for everyone who's joined us this evening. It was really important to Councillor Redrup and to myself, and also to Councillor Andre, who used to be the previous cabinet member, that we brought this as part of a scrutiny before we looked at our own strategy this evening. I will give you a couple of minutes, so if you want to leave, because it's horrible weather out there, councillors will remain. I'm sure the gentleman from the press at the back would love to stay as well. I'm going to make him stay. Thank you ever so much for your time. And for officers, please remember we are going to a very important part of the meeting next. We do have a strategy that we will need to try and approve this evening. If you would, who would like a comfort break for a couple of minutes before we restart? Are you okay? No, everyone's okay. All right. Thank you so much for your time. It's greatly appreciated. Bye, everybody online.
Thank you. Bye-bye.
Homes, apart from Councillor Jarman should still be here. Yes, good. And Councillor Andre should still be here. Lovely, thank you. Thank you. And we are now going to move to our Isle of Wight domestic abuse strategy and implementation plan. I had a very good conversation yesterday with Councillor Andre, and we are definitely singing off the same hymn sheet on something we do feel that needs to be recommended for this strategy before we move through to the rest of the questioning. So Councillor Andre and I both believe that you should take ownership of a document. And we have both noted that the foreword is from our previous Director of Public Health. And I think our one recommendation to the committee before we go into any further questioning is that that forward should be rewritten and actually been taken ownership by Kate Harvey, who is now our Director of Public Health. And that will be one of the recommendations that will be coming out this evening is, you know, if we do agree this strategy, which hopefully we will, that will be one recommendation that we would like that ownership to be taken quite clearly by our new Director of Public Health. Councillor Andre's there nodding her head as well. What I'm going to do now is bring in Nicola, I believe, to introduce this paper, and then I'll open this to questioning. Thank you.
Thank you very much, Chair. Thank you. I am just going to give you a couple of slides. It won't be anywhere near as many as the previous, I promise, so that we can get to talking.
I am assuming that everybody has read this paper, by the way. If not, they're in trouble. Okay.
That's amazing. Thank you. Thank you. Thank you. We would like to ask the committee formally to approve the Isle of Wight domestic abuse strategy and to note our implementation plan. As you've heard tonight, domestic abuse is a key priority for the Isle of Wight, and our strategy is aligned with national policy, but it's also shaped by local needs. And I will talk to you briefly about how those local needs have been represented. We've also worked really hard to really take into account previous feedback, and we've updated the work post-March committee with the implementation plan. And we really hope that you see that as a really positive addition to the strategy as it exists. Just to summarise, our vision is to improve outcomes for those subjected to domestic abuse and to create opportunities for change for those using harmful behaviours, both of those services that you've heard tonight. Our overall vision is that the Isle of Wight will be a place where people feel safe to live, visit and thrive, free from the fear of domestic abuse. We've broken the strategy down into 3 different priorities: prevention and reduction of harm, increased access to specialist support, and collaboration and working together across all of the agencies who talked to you tonight. To ensure the strategy vision and priorities reflected the local needs, the team worked really hard to go through multiple different steps to reflect multiple different voices. First of all, a needs assessment was created using local data and partner insights. The team consulted with victim survivors. That included people who were resident in the refuge, but also broader focus groups and one-to-one conversations. Specialist expert input was sought from a survivor expert consultant who's resident on the island. And feedback was gathered from services and professionals across all of the different areas in the round across the island. Finally, a multi-agency workshop was held to agree the values, the vision and the priorities, and the overall strategy was refined through the Domestic Abuse Partnership Board and the scrutiny that they provided, and it was signed off by that board of all the professionals who are sitting here today and broader. The implementation plan is a new piece of work, and it was created in response to previous feedback. It translates those priorities into clear actions and timelines. The Domestic Abuse Partnership Board had a very large and very complex spreadsheet of actions that was not fit for public consumption, but we needed a way to get that out to the public, to tell people what it is that we were doing and how we were going to achieve those priorities in a much more concrete way than was in the original strategy. And that's what we hope the implementation plan does. It also embeds monitoring and accountability through the board, and it also very clearly brings the survivor voice into the overall strategy. We asked members of our Survivor Voice Forum to review the implementation plan and the strategy, and I can give you concrete examples of changes we made based on that feedback. This overall provides a whole system approach to reducing harm and improving outcomes. So just to summarise, we do ask you to approve the strategy and to note the implementation plan. And we believe that if you do this, it will enable delivery of these coordinated evidence-based actions which have come from the community. It will strengthen and legitimise that partnership working, and it will reinforce the council's commitment to tackling domestic abuse. This will allow our services to work collaboratively to address those really complex problems that you've heard about tonight. It will embed prevention, because it's only through prevention that we will reduce things long term and reduce the demand on crisis services. And it will, we hope, position the Isle of Wight as a place where people can feel safe and live free from the fear of domestic abuse. Thank you very much, committee and chair.
Thank you. And Nicola, it was a really big ask of you tonight, and it is noted by this committee what a big ask it was, because Councillor Redrup and I were not shifting on this being the date that this came to the committee, and we do take on board that as a reasonably new employee of this council, to come here and actually sit in front of this committee without your director being here, we acknowledge what a huge thing that was to do, and you know, you have done it a really good job this evening, a really good job. You know, we're not the easiest of audiences, but you've handled it really well without the support of your director leading you. So I think that should be noted. And any future appraisal you had, just remind them that you did this bit on your own, okay? Just remember that. Committee, I'm going to hand this over to questionings, but I think it would only be right and proper that we bring in Councillor Andre to speak first, please, and to ask her question. Thank you.
Thank you, Chair, and apologies that I can't be with you in person tonight. I just echo.
Keep your germs, Councillor Andre. You can really keep them, okay?
Thank you. Just to echo the huge amount of work that has gone into this. The strategy that has actually come forward is an absolutely excellent document, and I think the key pillars, I think it's timely as well, isn't it, that the domestic violence against women and girls, the government have come forward with that today, and it's interesting to see actually how the principles in this strategy align quite closely with that. What my question really is that I note within the strategy, obviously, it is a living document. We've heard already through the scrutiny part of the meeting that it's been identified that there are obviously going to be gaps. So how are you going to use the strategy not only to identify the gaps, but to ensure that they are addressed moving forward as part of the strategy? Thank you.
Thank you very much, Councillor. I think something which we didn't talk about in our previous section, because it wasn't really appropriate, was the role of the Domestic Abuse Partnership Board. So everybody who has spoken to you tonight is part of that board. It's coordinated by the team, and it's chaired by Director Kate Harvey. We meet on a quarterly basis, and partners are asked to feed in their actions. They're asked to scrutinise the work that's being done, and they're asked to think about the direction they want to go in for the next quarter. And that partnership board will be the absolute key way that we both feed in the feedback for tonight, because it's really helpful around particularly those kind of mental abuse, mental health aspects that have been brought up. But it's that constant holding us to account. Every partner in that group is so passionate about those outcomes, so everybody holds each other to account. We always look at whether we've achieved what we wanted to achieve in the last quarter. And Kate's plan is that we will have an annual review, if not more than that, to make sure that we are keeping up to date with everything in the strategy and we are on target, and also looking at changes such as the report that came out today to make sure that if anything does need to change, because either a new strategy has come out or the financial envelope has changed, that we're able to react and to have those changes very quickly. So that's what I would like to say.
Thank you. Councillor Redrup.
I just want to say thank you. I really, really appreciate it. When this came to the committee, the previous committee earlier in the year, I felt like there was improvements to be done to make sure that we're telling the right story to residents, so that they can really understand like what we heard today about what is actually happening, and to give confidence to people that the Isle of Wight Council knows what it needs to do in order to address gaps and reflect what people feel. And I think that adding on this extra implementation plan does that, particularly about what we spoke about earlier about mental health. There is a section here about there's work that needs to be done to map and understand broader recovery options. And we know that there needs to be more funding for mental health, and that is a national problem. That's not just a problem here. And Women's Aid tell us that the amount of money that is needed to properly fund domestic abuse services is much more significant than it currently is. But that's, you know, this is a work in progress and something that we can work towards. But being able to work across multiple partners to address those issues, that's where we're going to be able to achieve it, even if the money isn't there. So huge thank you on that. I only had two small things that I wanted to bring up about the main strategy, the original document. One is the what was raised before about male victims. So I think it's important that image on the front page needs to be changed. The image on the front page of the implementation plan is perfect. So that I think should be changed. And also we had some really nice quotes that were given by Paragon from their service users. It would be lovely to see that in there as well, just to evidence that survivor voice. So I guess that wasn't really a question, more suggestion. Thank you.
I think that's brilliant. I'd like to bring Laura in, because Laura's lived and breathed this for a long time, and probably wasn't very happy with us originally when we said we're not quite ready for this yet, but it's 100% better document. Laura, can you explain your journey to get to the document to look like this now, please?
Yeah, absolutely. I'll try not to duplicate because Nicola's already taken you through kind of quite a comprehensive. And it feels like we spoke to every person on the island. Clearly we didn't, but we did speak to many, many groups through one-to-one conversations, through workshops, through forums, surveys, etc. So we kind of gathered that. I guess just picking up on your points, I think we'd really welcome amplifying that voice of people with lived or living experience. So I think adding some feedback that we have would be really welcome, and we do actually have permission from when we completed that work to develop the strategy from some of the people we spoke to, so we'd be very happy to go back and add some of those bits which might also sort of tell more of the story, because not everybody, you know, chooses to use commission services. In terms of the cover was actually chosen by survivors, and it replicated, so that was particularly from residents in our local refuge who we spoke to many people about it, but they were particularly vocal. They wanted somebody who looked like they were working towards their ambitions. They wanted it to reflect that an abusive period in your life is not for your whole life, and that actually there is recovery beyond that. So they wanted someone who didn't look, I think in their own words, downtrodden and depressed. So that was that. They wanted the sea in the background because they wanted it to be relevant. And then it was also kind of informed by our understanding about domestic abuse being a gendered crime. So we absolutely understand that it does impact people who are not women, but what we also know is the evidence tell us it predominantly impacts women. So that's why the cover was chosen. It was directly from our victim survivors on the Isle of Wight who specifically gave us a very, very clear briefing about what they wanted to see on the strategy cover.
I think that would be lovely to include in the strategy, just an explanation of who chose that, because I think that adds a lot of extra context to it that I think is really moving.
I think, Laura, Councillor Redrat's really right, that actually just your comment there shows how much involvement you've had with this paper and the level of understanding of everybody who's input towards, you know, the production of it. So I completely agree. I think an explanation of why the cover is is fantastic. That, you know, I think you should just replay that part of the meeting and say, don't think about it too long, just replay it and go, this is the quote, because you summed that up perfectly. It was really well done. Councillors, there are any further questions before I come to a couple of recommendations? Councillor Nicholson, and that's it. So then I'll bring you through to, and Councillor Groutwyn, then I'll bring you through to recommendations. And Councillor John.
This is a good strategy, but is it an isolated strategy, or does it interlink with other Isle of Wight Council strategies?
We're really keen to make sure that this isn't a standalone document that sits on the shelf. And so that was something that we brought in very early on. And I think the links with the safeguarding boards are where this links in very clearly to the other strategies on the Isle of Wight. So I'll pass to Laura, if that's okay, to a bit more detail. But our relationships with safeguarding.
I didn't see a list of strategies that it interlinks with.
And we can do that, can't we?
Yes, so the original paper prepared for tonight, I think, was around 25 pages long. And there is actually a list in there of strategies. So we could very happily submit that to you. So as part of the development process for this strategy, we had a number of, as I spoke about.
That's fine. I just wanted to check that we were a joined up council, that's all.
Yeah. Thank you. Thank you. Nicola.
I just wanted to apologise to Laura because she has put a lot of work in that I ended up just calling very aggressively.
That's fine. Councillor Gladwyn, then Councillor Jarman.
Yes, this is a really good document. The only thing is on sort of like page 47, under seeking support. I mean, I'm aware that this possibly might not be the only thing that somebody actually saw when they're looking for help, but it could be the only thing that they're seeing. And I just think it would be useful to have on that page a number that somebody can call, local number, with sort of like opening times, so that if that is the only thing they actually see and they're looking for help, then they can just get on the phone and just speak to somebody in confidence. So I just think that would be useful.
That's really helpful. Thank you, Councillor. I've realised now, sitting in front of you, with the implementation plan, we were very careful to put the seeking support box in, and I think adding it to the strategy as well will be really key. We didn't put the names of Paragon and our services in that box because we're aware that we may have changed contracts by 2029, so we wanted to make sure we'd always got the link to the Isle of Wight Council website because that will always be up to date. But one of the things victim survivors actually said to us, and the reason we've put this on the absolute front page, was they said exactly what you've said. This may be the only document. People may find this because they're looking for support, and that needs to be absolutely front and centre. And so I will make sure that's rolled into the other document as well. Thank you.
Thank you.
Councillor Jarman.
Thank you, Chair. So first of all, before I do what I was going to question, I'd echo what Councillor Redrup said. I noticed that we have the same picture on page 31 as we do on page 55. And it's of a man and a woman sat next to each other. And I looked at that picture quite hard, and then I saw it again on page 55, and I also looked at it again hard. I think there is some opportunity to reflect on the use of that particular picture, and particularly using it twice. The female who's in the picture has her arms together in a very passive mode. The male has his arms open, rather like chopping boards. That's how it came across to me, and that could seem a little bit more aggressive. So I don't want to overly criticize it because I like the paper very much. I just think the use of that picture twice, and that particular picture with those particular poses, just raised a bit of a red flag with me. But to come on to my question, one of the parts of the announcement that came out today wasn't only about schools and misogyny and changes to the way we deal with young people in education, which is part of that prevention journey. It also talked of aspects about other cultures and how we reflect on the number of people who join us in the UK who perhaps come from a different culture where, in their view, the theatre of domestic abuse may be viewed very differently from our own. And I wondered where within our strategy we were looking at embracing that multicultural aspect of it and trying to, if you like, fast track people to a more considered approach, which is where we are trying to get to ourselves. Thank you.
Nicola. Thank you, Councillor. That's a really interesting question. And I think it's one of those where the living nature of the document means that we can start to reflect changes in demographics, patterns that we start to see. But before tonight's committee meeting, I did speak to our various services around representation in services, different groups, different kind of where service users came from across the island. And they were very clear that service users come from all different kind of groups across the island, but they largely represent the general kind of demographic breakdowns of the island, and we don't see any overrepresentation currently. So I think it's one of those things that we watch and wait, and we ensure that we're continually responding to any evidence that we have that things are different. But really helpful. Thank you.
Yeah, just to add to that, I'd say that both the strategy and related to that as part of our strategy, the specification that underpins our contract is about reducing barriers to support and recognising that those barriers might be different to everyone. So, for example, in the case that you highlight, there's a specialist knowledge within our commission services about how to support people with no recourse to public funds, for example, and use of language services so that language isn't a barrier, etc.
Thank you, Laura. Thank you, everybody, for putting together this strategy. I think, this committee, there is a whole different, having run the corporate scrutiny committee in the past when, the original strategy, there's a very different feeling this evening. I do have 3 recommendations to put to the committee to see if we can gain your approval. Those recommendations are that the forward be updated by the new Director of Public Health. There is an inclusion of a paragraph explaining the cover image, and that inclusion of quotes from Paragon service users are also brought into the document. I think if we could vote on those, then we would then vote again to recommend that we recommend the strategy. Is that okay? So are you happy with those? And we move that to the vote. Everyone happy with that? And so I will move to the vote that the Isle of Wight domestic strategy, if you include our recommendations, we agree to be approved. Thank you. I now quickly move to the committee work plan. I do know that lots of you have got long journeys home and in bad weather. And my thoughts go out to Councillor Price at the moment, who has regularly been has terrible flooding issues with his business at this time. So I really appreciate for him coming this evening. I know what he's been through, and it must be a very difficult time for you. And this committee, extend their gratitude for you coming this evening. So committee work plan. We don't have a subject yet for the health scrutiny part of the meeting. I have a few ideas. So what I thought I'd do is, over the Christmas period, I'm going to give you all some homework that we can agree by 3rd of January. I'm looking at Mel. That I can get agreement by the 3rd of January by Mel on what topic we would like to see, because February will be our last meeting of this committee before the next new council. It'll be your last meeting with me as chair. You can all applaud if you want, but it would be quite nice if we could make it something really meaty. So I've got a few suggestions. If you could all say yes or no, or I'll put about 3 there because there's a few, and I certainly can't decide on my own, and it's not my right to decide because we are a democratic committee. So if that could be okay, and Mel was happy with that. you happy with that? You're going to throw anything at me?
I was just going to say that in the last agenda planning meeting, there was the topic put forward potentially of health inequalities, and we would invite the trust to attend. So just putting that one out there as an option.
Yeah, there's about 2 or 3 that I want to ping out and see which ones of you vote for it the most. So if you will say this is what you do, and then the majority will get that to come to the health scrutiny part. Does anybody have anything else? Any issues with what's coming in the February meeting? Are we all happy? Oh, if we're all happy, and Mel is happy, which is important, and Megan is happy, then thank you everyone for attending this evening. It is appreciated. There were notable absences this evening, but we understand why. And do you know what? It's really nice to see that some of our directors are actually having some well-deserved leave. I appreciated the email that said do not disturb, but every little bit of naughty girl wanted to say, how's your holiday going? I've got this coming up, but I didn't. Thank you everybody for your time this evening. Have a safe journey home. And please, I would wish you all, season's greetings. And I hope that in the new year, we all come back being refreshed and ready to carry on with the work that we've got to do up until May, when some of the faces will change. But I'm sure the commitment to representing residents will still remain and be committed by all of you that get re-elected. So that's your commitment for January when you come back, and all of you lot just go and have a rest. Okay, thank you ever so much.